The area of presentation chosen by you is advances in nuclear medicine. So could you please brief us more
That's
on
right.
this? What kind of things you're going to talk about in the presentation?
Okay, now I'll be basically talking about the specialty of nuclear medicine, which has been around for the last 50 years in our country.
Yes, sir.
And three main focus areas I'll be concentrating on is in oncology, in neurology, and in cancer.
Okay.
So these are the three broad areas where nuclear medicine has made a very big impact in the diagnosis and management of various diseases. So I have actually three presentations, in one presentation in each of these topics,
Okay.
and I'll be highlighting what nuclear medicine has to offer and what are the new exciting advances in each of these fields, in cardiology, neurology, and cancer, where we make a big impact in the diagnosis and management of these patients. So that's the whole broad outline.
Okay. So, what should be the takeaway, or what should the delegates take home from this topic that you've chosen? How should they be prepared for this presentation when they listen to you?
Yeah, they will come to know what is available in our country and what is the latest advance, and how do we compare with the rest of the world with respect to management of key diseases. For example, we can talk about cardiology. If you want me to elaborate, I will do that now. In cardiology, India is going to be declared as the diabetes capital of the world in the next few years. And coronary artery disease, that is people getting heart attacks, is going to be a very major problem for us, because Indian population is unique in the way that we get heart attacks at an earlier age, and our coronary arteries are smaller as compared to the rest of the world. And it's a sort of a syndrome X, which is a unique disease prevalent in India. And so the management of coronary artery disease is going to be a huge problem in the coming years. And we need to have techniques which will help us to diagnose this problem very early, and also to make proper, appropriate management decisions. So far, coronary artery disease has been managed only with the angiography. If a person gets chest pain, he goes to a cardiologist, the cardiologist does an angiogram, and you show blockages of various arteries. And then the next step is the cardiologist opens up these arteries, either with a angioplasty or with a bypass. Now, we have realized that this approach may not be appropriate in all the cases. So just because you have blocked coronary arteries, it doesn't mean all of them need to be opened. Only those need to be opened who are causing a problem, and we have to identify high-risk patients who are going to develop a heart attack because of these blockages. So this is an anatomical diagnosis with angiography, and with the help of nuclear medicine, we help to identify these patients who have blocked arteries, who should go for angioplasty or a bypass, and who should be managed by medicine. So this bifurcates. So a lot of unnecessary angioplasties and bypasses can be avoided by a proper combination of nuclear medicine techniques and the coronary angiogram. So this is a new paradigm shift which is occurring in the management of coronary artery disease, a combination of anatomical information and the functional information provided by nuclear medicine. Neurology also, we have a fairly major role. See, nuclear medicine, what we do is we inject radioisotopes into the body, and then we scan the different parts of the body to look at the function of the different organs. For example, in the brain, if you are thinking, if you are angry, we can show which parts of your brain are activated. If you are depressed, if you are losing memory, which part of your brain is involved. For example, if you put a dead person inside a CT scan machine, you'll find everything is fine, the structure is intact. You can see different parts of the brain. But if you put him in a nuclear scanner, you'll find nothing because he's dead. Right. So that's the difference between the CT scan and a nuclear. Medicine. CT scan gives you anatomy, it shows you structure. Nuclear scan shows you whether the organ is functioning properly or not. Right. Is it doing what it is supposed to do? So nowadays, memory loss is a big problem. Alzheimer's disease is a major issue in the rest of the world, and in India also it's coming in a big way. So many of us, as we grow older, we stop remembering what we ate yesterday night, where we have kept the keys. So the real fear is, am I developing Alzheimer's disease, or is it part of normal aging process? So with the help of nuclear scans, we can distinguish, is this memory loss just part of normal aging, or are you at a risk of developing a serious disorder called Alzheimer's disease? So we do several scans called as FDG PET scan and amyloid PET scan, where we can pick up the signs of early Alzheimer's very early. Even in patients who have not have the symptoms, we can detect them early, and we can sort of now in future there will be medicines available which will retard the progression of this Alzheimer's disease. So if we can identify at-risk individuals, we can help them to prevent, not prevent completely, at least prolong the onset of this very bad disease. And those who have the disease, we can make their life a little better by appropriate management. That is as far as neurology is concerned. Then the third major focus is going to be cancer. Cancer again is a major problem in our country. And with the help of nuclear medicine, a special scan called as PET-CT, positron emission tomography CT scan, we can pick up cancer very early, we can see where it has spread, and we can also monitor the response to treatment. In the past, what used to happen, if you have a cancer, you used to start chemotherapy. And after 6 months of chemotherapy, you used to find out that this patient is not responding. He would lose all his hair, he would have all the side effects of the chemotherapy, and then they would realize, no, it's not working. Now with the help of a PET scan, after starting the first chemotherapy cycle, I do a PET scan, I can immediately know whether this chemotherapy is going to work or not. Now the cancer picks up glucose, so we inject radioactive glucose. So if the cancer cells pick up the glucose, that means they are active. And when I give the chemotherapy, the cancer cells stop picking up the glucose, I know that the chemotherapy is successful. So as early as the first or second cycle of chemotherapy, I can predict whether this patient is going to respond or not. If I find he is not responding, then we tell the doctor shift to something else. So the patient is saved from unnecessary toxic chemotherapy and he is guided to a appropriate, proper, which will help him counteract this disease. So these are the three main areas which I hope to focus on and tell where in India all this is available and the cost and how, what are the recent advances.
When you talk about cost and advance, when we talk about advances and innovations, there is always a cost in it. And Jaslok Hospital and these kind of hospitals, obviously, people can afford when they go there. But what about people who are who cannot afford these kind of treatments? So, is it actually affordable, or is it something meant only for top brass and the lower strata would always be left out?
No, it is a modality which is now getting affordable for everybody. So India is a unique country where you have these facilities available for the super rich in 5-star hospitals, and you also have these facilities is even government and municipal hospitals. The government of India, in its wisdom, has put up PET CT scanners at several places in government hospitals. So this machine, which costs something like 10 to 12 crores, is available now in more than 70 centers in our country. And many of them are in government hospitals. For example, in Bombay, there is a place called Radiation Medicine Centre, where you will get a top-class PET CT scan, which costs around 23,000 rupees in a private setup. You will get it for as low as 4 or 5,000 rupees. In a several semi-private institutions who are also offering these highly costly scans at a very affordable price of about 8,000 rupees. So I think this modality has become now available to everybody. So it is not that only the super rich can afford it. Everybody is can make use of this.
And when you talk about government's intervention in these things, sir, we see that government has not really been so empathetic towards healthcare as an industry. So do you think we actually lag behind when we compare ourselves with other countries, sir?
In fact, this is one very positive part about our Indian governance, that in USA, for example, you will never get a PET scan free. A PET scan in USA would cost you about $3,000 to $4,000, which would be around almost 1.5 to 2 lakh rupees.
Yes.
While in India, we give this test for 23,000 rupees for the rich, and as I told you, 5,000 rupees for the poor. And the government has put up these scanners in municipal hospitals. Is there in, I told you, Radiation Medicine Centre. There is All India Institute, which has 2 PET scanners. There is Postgraduate Institute in Chandigarh, which has a PET scanner. It is in Lucknow, the SGPGI Lucknow. So every government and semi-government institute is now realizing the value of this technology and it is putting it up. It's a great boon for the people of India. While abroad, it is all insurance driven and you have to pay a lot to get this technique. So that is one positive point about the Indian health sector, where a very highly expensive technology is being made affordable by the government. We are also treating a condition called neuroendocrine tumor, which is a rare tumor which is increasingly becoming recognized in India. There is a very effective therapy for this tumor called peptide receptor radionuclide therapy, which comes as part of my specialty, nuclear medicine. This therapy is available abroad in Europe for a cost of 10,000 euros per cycle, and you have to give 4 cycles. So we are talking about 40,000 euros. That is 32 lakh rupees. Now the Bhabha Atomic Research Centre makes this therapy available to us, and we can give it to the Indian people for 80,000 rupees per cycle. So 33 lakh 20,000 as opposed to 32 lakhs. So you can see the government has made this possible to get this highly effective and advanced technique for our people. So these, I think, are very positive points about the healthcare which the government is really doing its best to make this affordable for our people.